Hi, I'm Craig Brown. I'm a colorectal surgeon practicing in Denver. I just wanted to share a few thoughts regarding rectal bleeding. Rectal bleeding is one of the most common things that we see and evaluate in our office. There are several sources of bleeding that we evaluate. Bleeding can occur in young patients and older patients. Our office is specifically designed to find the source of bleeding and treat it appropriately. If you see bleeding, you typically see it when you have a bowel movement. Painless bleeding, most commonly in young patients, is from internal hemorrhoids, which we can treat in the office. We try to treat hemorrhoids without surgery if possible. Bleeding that is painless can also be from more serious conditions such as colon cancer or colitis. In younger patients, colitis would be more common, and in older patients, colon cancer could be a common source of bleeding that is not from hemorrhoids. Bleeding that is associated with pain is often secondary to a problem called an anal fissure. That is a tear in the anal canal, and it can be very painful with bowel movements associated with bright red blood. When you come into our office with a history of bleeding, we can do an exam in the office to look at the anal canal near the opening and also the rectum to find the source of the bleeding. Usually we can know the source of the bleeding from those exams. If for some reason you're having bleeding and we do not know the source of the bleeding from doing the office exam, then we may suggest that we perform a colonoscopy, and we can do that procedure for you as well. We try to keep our procedures to the simplest, most efficient way to find the source of the bleeding and find the simplest treatment possible. Please feel free to call our office with any questions.